Hello, everybody. My name is Mario Nubile. I am associate professor in ophthalmology in the University of Chieti and Pescara, Italy, and head of the cornea and ocular surface service. I am focused in ocular surface disease and corneal surgery and refractive surgery. Patients who are suffering from chronic eyelid disease, including symptoms like discomfort or itching, or signs like evidence of anterior blepharitis or meibomian gland dysfunction, should be prioritized for Demodex blepharitis screening. And it is especially true in those patients who have no idea of what is the underlying condition bothering their ocular surface. And I would say that particularly patients who are not responding to conventional dry eye or meibomian gland disease classical treatments should be screened for Demodex blepharitis. And patients who have seek the opinion of many ophthalmologists, tried many kind of drugs, many kind of eye drops. These are the patients that you should look for, and especially the elderly patient or the patient who are candidate for anterior segment or any kind of ocular surface, including surgery, including keratorefractive surgery, cataract surgery, and even vitreoretinal surgery. Okay, first of all, it is really easy to diagnose Demodex blepharitis. Just a simple look at the slit lamp when examining those patients can give you the clue of Demodex infestation. But of course, you want to categorize the kind of disease that can be associated with comorbidities of the ocular surface and of the eyelids. Therefore, you want to check out further what is the status of the ocular surface health. And therefore, new technologies like meibography, non-invasive tear breakup time, inflammatory marking testing like MMP9 or others in the tears can be useful in order to have a full picture of what is the status of the ocular surface of this patient. I'm trying to understand what is the impact of the Demodex blepharitis alone and what is the impact of the maybe coexisting comorbidities in those patients, especially keeping in mind that if they were treated, as we said before, with no sufficient benefit or amelioration of the symptom, therefore there might be an issue with Demodex blepharitis that you want to pick up. Okay, first of all, it must be considered that usually the eyes see what the mind knows. And if clinicians usually are taking examination without considering the possibility of a role of Demodex blepharitis or Demodex infestation as a factor influencing the health status of the ocular surface, then they could miss up a point which is important to remind. Therefore, clinicians should be instructed in considering that screening for Demodex blepharitis is important in every kind of patient that might be relevant of like as we said before, candidate for surgery or patient with anterior blepharitis or not responding to conventional therapy. So the role of the key opinion leaders is to build somehow physician awareness of the disease. And of course, trying to integrate, to encourage this kind of interaction into the classical routine practice. So Demodex screening can be easily incorporated in the standard assessment of the classical examination of our patients. It is quite important because this disease has a high prevalence. And being highly prevalent, it may affect a vast majority of our patients, especially patients that we're going to operate in the following few weeks, and probably we want to know if they are affected by a Demodex infestation prior to surgery, especially if we could improve the status of the eyelid margin. So it is important to understand whether you are facing just a simple dry eye or meibomian gland dysfunction, or something in which Demodex may be involved,